Non-rebreathing mask. Basic difference between PRM and NRM is with mask and reservoir. NRM also contain the three one-way valves. So here in this image you can see this is the mask, this is the reservoir bay, and these are the three valves. So one is the reservoir valve which is between the reservoir bag and the mask. So this is the reservoir valve, and this one-way valve is closed during the exhalation. When baby will exhale, this valve will be closed so the room air and the exhaled air will not enter into the reservoir bag. And this valve is open during the inspiration. So oxygen will be enter into the mask and baby will inspire, and this bag is connected with the oxygen. This is the oxygen tubing. So when this valve is closed, this oxygen from the oxygen source will fill the reservoir bag. So this bag is filled during the exhalation when valve is closed and oxygen source deliver the oxygen to the bag. So this valve allow only oxygen from source to enter the reservoir, thus prevent the rebreathing, and during inspiration this valve will open and provide the high FiO2. Now these are the two exhalation ports. This also contain the one-way valve. So these are the one-way valve at the exhalation port. So these valves remain closed during inspiration. So room air will not enter into the mask. So these valve will be closed and this reservoir valve will open. So high FiO2, high oxygen concentration will be delivered to the patient. So in expiration, exhalation ports open and reservoir valve closed. So exhaled air will go into the environment. So this is the main difference between NRM and PRM. This also contains the three one-way valves. So here in this video also you can see these are the one-way valve at the exhalation port, and this one is the reservoir valve, and this is the oxygen tubing connected to the reservoir bag, and this is the reservoir bag of 1 liter capacity. This is non-rebreathing mask. Now flow rate in the NRM between 10 to 15 liter per minute. At 6 liter per minute, 55 to 60% oxygen concentration will be delivered. At 8 liter, 60 to 80%, and at 10 liter, 80 to 90% oxygen. So at least 10 liter per minute rate should be set, so the 90% oxygen concentration will be delivered. At 12 liter, 90%, and at 15 liter per minute, 90 to 100% oxygen concentration. It is used when the patient is having a spontaneous breathing with the severe hypoxia. Example in the shock, respiratory distress or cardiac failure. What are the advantages? It is useful for the acute situation and short-term use. Highest possible FiO2 without intubation can be delivered by the non-rebreathing mask. Disadvantage, uncomfortable because tight seal is required between the mask and the face. Difficulty in giving the feeding and suction, and irritation in eyes can occur because of NRM.